But the insurance sector in Tanzania, it is still very low. I think it's about 2% of population does have insurance.
Hello from the World Physiotherapy Congress 2025 in Tokyo. I'm broadcasting to you from the city center in Ginza, and I have Remla here, Remla Mramba from Tanzania, and you've hosted a session on should physiotherapy a business? So you're from Tanzania. Is it a business in Tanzania?
Physiotherapy is a business in Tanzania, yes. In Tanzania, we do have both public and private sector physiotherapy services. Mostly, of course, it is still in public, but private sector does help to bridge the gap where public sector cannot reach. And when we talk about the private sector, we're talking about both small businesses, physiotherapy businesses, private hospitals that offer physiotherapy services, but also non-governmental organizations, NGOs that are also offering physiotherapy services. And with the NGOs, there's both missionary, so faith-based organization, and also international organization and local-based NGOs.
So it was a very, very interesting discussion here in the podium about the question for who's paying first. So is it the patient or is it the public healthcare system, and which patient comes first?
Patient comes first. In Tanzania, when it comes to private services, usually it's cash-based. A majority of it. Of course, there's insurance sector, but the insurance sector in Tanzania, it is still very low. I think it's about 2% of population does have insurance. Recently, Tanzania has signed up to the universal health coverage, and so with that, it means everyone would have to have some form of health insurance, and with that, I believe it would also help in improving accessibility to physiotherapy services.
I think there was a consensus that the people said that treatment internationally should be free of charge. So, but how can it be done? We have over 200 different countries and systems.
There's never free of charge. Somebody has to pay somewhere, whether that is the government paying for the people or whether it is out of pocket. But nothing is ever for free.
Yeah, but who gets the treatment first?
You mean the cash-paying patients or the public-paying patients?
I think it's a question of level of injury. Who's more important for the system, the payer or the one with the bigger injury?
I think ethically it has to be the one with the bigger injury first. And being a physiotherapist and a professional, ethics needs to be leading the way.
So any physiotherapist has to decide for himself how ethic he is or how business style he acts?
I think you can always do good business if you're ethical. So whatever it is, you will start with ethics.
So Remla, if you have one final advice for especially young physiotherapists, they have to think about how they earn money for the future. What advice do you have for young physiotherapists?
Be professional, be good at what you do, let word of mouth speak for you. It takes time, but it is worth it, and that actually builds for longevity.
Is it a good advice just to spend, let's say, an amount of time free of charge to patients who need it?
If it needs to be, so you mean as a volunteer, it's always good to give back to the society. I'm not saying it's a must, but I'm saying you're not going to be losing anything by giving your service for free.
Perfect, Remla. Thank you for this interview. And for all of you in Germany, thank you for watching. Bye-bye.